We begin with a demand from Canada's premiers. They want a meeting with the Prime Minister by January to hammer out a new funding agreement on health care. The system is under overwhelming pressure and beginning to crack. The feds say they'll give provinces more money, but they want strings attached.
We know that we need to work together to make it better. And yes, that does mean some more investment, but it also means a focus on being sure we get the results that Canadians quite rightly expect of us.
The Prime Minister will obviously do what he wants to do. What he has asked me to do is to work with my colleagues, health ministers, to agree on results and putting, therefore, the ends before the means.
Heather Stefanson is the Premier of Manitoba and the current chair of the Council of the Federation. Premier, when I watched your news conference earlier, I saw a majority of premiers who are running surpluses and many who are sending checks and rebates to voters, yet you all say you don't have enough money for health care. How should Canadians view that?
Look, the fact of the matter here is that the amount that the provinces and territories have been putting into healthcare has been on the rise. It's encroaching on other areas of our budgets, and so it takes away from things like education, childcare, those other social services that are very important as well. While that's been on the rise, it's been on the decline on the part of the federal government. So we want to get back to a fair partnership with the federal government. So all we're asking for is to sit down with the Prime Minister and have that discussion. We've got our offer on the table, and I know that he has indicated already that he's willing to put more money into the Canada Health Transfer. I think that's a positive sign. And I think we just want to sit down at the table and have that discussion with him.
Right. Well, you're not just asking for a meeting, you are asking for $28 billion a year plus 6%. I mean, that's your offer as you describe it, 6% a year after that. I wonder, Premier, would you commit that 100% of every new dollar goes into healthcare and doesn't displace existing provincial spending on healthcare, so that whatever you get from the federal government is a dollar-for-dollar increase in the provision of health services across the country?
Absolutely. We need to make sure that there is more money for healthcare and that it doesn't. And we need predictable, stable funding and a partnership in the federal government back, in healthcare. And so we're looking for that from them. And so absolutely, we will be making sure that money goes towards healthcare. So
if you're willing to agree to that in a broad principle, why not on a more detailed level of showing the results, which is something that Health Minister Duclos has been asking for, that you need to agree on what your targets and what your results are going to be before you can agree on a dollar amount. So if you're willing to put dollar for dollar in, why not go that step further and agree to hitting certain metrics here?
Well, I'm not even sure what Minister Duclos, we shouldn't be discussing this and negotiating through the media. We need to sit down at the table and have that discussion with the Prime Minister. We have no problem as provinces and territories when it comes to accountability. We're accountable every day when it comes to our citizens in our provinces and in our territories, and we'll continue to be accountable when it comes to the delivery of healthcare services. We have no problem being accountable and being transparent.
But why not the data sharing and accountability measures that Minister Duclos has asked for?
Well, again, I don't know that Minister Duclos has asked for that. He has had no plan that's been put on the table for anyone. That's why we need to sit down at the table. If he wants to talk about those things, let's sit down and have that discussion at that table.
So I was wondering today, I was struck today, we've heard this request for a meeting with the Prime Minister many times now from the premiers over the last 2.5 years. What we didn't see today was any kind of a detailed response to the crisis that's happening right now in the healthcare system across the country. We've seen pediatric facilities being overwhelmed. We've seen, deaths of children due to influenza in multiple provinces at this point. We all saw detailed responses to inflation and cost of living. Why aren't we seeing that sort of urgency when it comes to the day-to-day crisis happening in the hospital system right now?
Oh, I think there is urgency, and every province and territory is responsible for delivering those services within their provinces. And that just goes to say in the importance of making sure that there's more money at the, in the way of the Canada Health Transfer, more money in the bottom line, because every jurisdiction is different across the country and will have different pressures across the country. That's not going to stop us from delivering healthcare in our provinces and territories. We will continue to do that.
I wonder, though, the Canadian Medical Association says that every day that passes without an agreement is another day Canadian patients are left waiting unreasonably long. I mean, is this sort of standoff that's happening over should the health ministers meet versus the first ministers meet, is it worth it to hold out and have this sort of fight with the federal government over who's going to have this conversation while the stress and strain is causing such enormous harm across the system right now?
Well, we're continuing to make those investments as provinces and territories within our own jurisdictions. We're not letting that stop us, but what we are saying is that we need to have predictable long-term funding from the federal government. We need them back at the table to ensure that there's stable funding for healthcare in the future of our country. This is one of the most important issues that we're facing across the country, and it's really important. I think Canadians expect us as leaders across this country to sit down with the federal government. They want to see us work this out, and that's all we're asking for.
So what if the Prime Minister won't agree to a First Ministers meeting in January? I mean, will you let your health ministers meet and try to finish the work that they started in Vancouver?
Well, I'm hoping that the Prime Minister will meet with us in January, and certainly the ball is in his court, and I want to ensure that he knows that we are ready and willing and able to sit down with him as premiers across this country and have this very important discussion on the future of healthcare in our country.